Hello everybody, I'm Dr. Schallen. You don't see me on camera, but this is my son Harth, and we're here at CMA Medicine, and we're going to talk a little bit about laser hair removal. Harth has worked with us here at CMA, and he's also been a patient. And so Harth's going to tell you a little bit about his experience with laser hair removal. Harth, let me ask you a few questions. Hi everybody, I'm Dr. Schallen at CMA Medicine, and I'm here with my son Harth. Harth has been helping us here at CMA for the summer and for vacations, but we're here today to talk about Harth as a patient because he's also had some laser hair removal. And the laser hair removal was actually for a particular reason. And Harth, you want to talk to us a little bit about what got you into the whole laser hair removal process?
For sure. Back at the beginning of 2020, I had to have a pilonidal cyst removed. And those are usually caused by ingrown hair and skin collections. The one I had, which is characteristic, is formed near my tailbone. So the physician said after removing it, I would need laser hair treatment in order to, mitigate the amount of hair that would grow there and prevent it from coming back.
Awesome.
So that's why I went to get laser hair treatment for that area.
Spoken like a future physician. Very nice. So yeah, you can get a pilonidal cyst. People get them. They're by the tailbone. Oftentimes they have to be surgically removed, and that's what happened in Harth's case. But what is left over are a lot of hair follicles, and you want to make sure that that wound heals well, but that the hair follicles are also completely removed, or else it can recur. So we see patients here at CMA, and Harth became one of them, that had laser hair removal in the lower back region to make sure that that pilonidal cyst stayed away and everything healed up well. But then in addition, we decided to kind of do some cosmetic laser hair removal as well. And so Harth, we did your back, right?
It was my lower back and upper thigh, back of my thighs that we definitely took a little bit off of just to sort of see how that looked.
Yeah.
In addition, of course, as you said, the sister.
Yeah. So, and you did great. Was it awful?
No, it wasn't. It wasn't. It was quick. And it is a process. It's not an immediate, result thing.
Right.
So it does take a few rounds in order to see noticeable results. So don't expect anything like overnight, but it'll be good in the long run.
Well, that's actually a really great point you bring up, because you can remove hair with a lot of different types of lasers and IPL and wavelengths, but the best way to do it is with two particular kinds of wavelengths. And if you have lighter skin and no tan, you can use what's called an Alexandrite laser, and the Genelaze or the Genelmax is really an amazing laser with the 755 nanometer wavelength that you use. And if you're lighter skinned, then you actually get an immediate result. But you have a lot of hair follicles, and so there's a cycle of hair growth. And so you've got to catch the follicles at the right stage of the cycle, and that means you have to do multiple treatments, and that depends on what part of the body you're on, or that you're treating, and some of them are spaced very closely every 4 weeks, and some of them are spaced every 8 to 12 weeks. But if you have darker skin or you're tan, you really need to be careful, and you need to use a different wavelength, and the best wavelength, the safest wavelength, is the 1064, the ND-YAG. That is absolutely the wavelength that one should use for darker skin types. And again, the Genelmax has the 1064, the Genel-YAG, and so that's what we used on you. Yeah. That's what I've used on me. And you just have to do multiple sessions depending on where you're treating, and some of them are pretty closely spaced, like on the face. And the further away you get from the face and the midline, the longer the treatment is generally.
Yeah.
Kind of how it goes, but
Interesting.
yeah. Thanks.